Estás viendo Canal América, televisión dominicana para el mundo.
A Time for True show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for True show. I'm your host, Dr. Bernard Fialkoff, and tonight we have another interesting segment on how to get back the smile you want, the health that you want around your gums and your teeth, and some actually positive news on what's possible and how far we've come in dentistry. The techniques and the technology that have come about in the last 10 to 20 years is amazing. And so tonight we're going to be dealing with regeneration, something that sometimes is a little difficult to do in life. But we're going to talk about regeneration, turning the clock back and getting things back instead of losing more and more. And engineer, if you'll put the presentation up on the screen for our viewers, we will begin on this presentation regarding the regeneration of your gum tissues and using a very special liquid solution that we include to grow back the bone. And then there we go. And if you leave it there on that slide, on the next slide for me. There you go. And here you see something that is very commonplace. Many patients come in complaining of receded gums, periodontal disease, gum disease. Unfortunately, with the bone loss, causes tooth shifting, causes lengthening of the teeth, sensitivity, and receding gums. And here you see a young woman who actually had braces. This is also very common with braces because the teeth are crowded and the bone is narrow, and there's a tendency, a predisposition to having recession. And you can see on the upper right picture the recession that she had, the inflammation around the area. And I explained to her that we would try to graft the gum back, but that, wasn't 100% predictable. Sometimes we may still have to do something else with the tooth or a dental implant, which is an option, but we want to avoid that. And so you can see how she presented on the top picture. And on the lower picture, which I know will be to everyone's amazement, is only 2 weeks after the soft tissue graft, where we actually grafted that tooth. And the lower picture, the result, 2 weeks later, she was obviously very ecstatic and very, very pleased. So let's go to the next slide. Now here is another patient, and on the upper photograph you can see that the patient had something that was bothering them and also was important for the orthodontic treatment to be stable. He had that little muscle pulling in between the two front teeth, and that's an anatomic problem. It's not something that the patient created, but anatomically, this is something that they have. Years ago, we would have to do a much more aggressive procedure. But over the last 30 years, I've been doing laser treatment. And so the result you see there was done without surgery, but with laser treatment. And a little tiny bit of Novocaine. It's a very comfortable procedure during and afterwards. Almost no discomfort really afterwards, a slight bit of soreness. And the laser actually removes that muscle that's pulling between the teeth. The reason that's so important to orthodontics and to the orthodontist is that if we don't leave you in a stable position, the spacing between your teeth can change, the teeth can shift, and the anterior space can open back up. By removing that muscle pull and removing those elastic rubber band fibers, what happens is now your result is stable, your gum is more comfortable to you when you brush, and this is a man, he was very happy. Next slide, Buddha. Now, I put this one up, which is only 10 days after the gum graft surgery, because I thought it was important to show you that how quickly we can reverse what's going on with recession, with cosmetic problems, and with sensitivity. So this happened to be a woman. She came in and she was in her 40s, and she was sensitive on the lower teeth. Her lower gums had receded and stripped away. You can see that muscle that you saw on the other patient. This one happens to be on the lower, in the middle. And so what we do is we do a gum graft procedure. And with this gum graft procedure, we place the graft where the person is devoid of tissue. We prepare the roots. We clean them so they can accept the gum tissue. We put some special, as I told you, a mediator, a liquid mediator. And there you see the result at 10 days. It's a little bleeding because we removed the stitches. And I actually wanted to show this picture so that you could see, because at 10 days, it's a magnificent result. And you can see how now this person's tissue, this woman's tissue, is going to be thicker. It's going to be resistant to abrading and to receding. And she was very, very happy. Next slide. Now, we talked about the liquid mediator, and it's actually made by the Straumann company that I want to give credit to, very good company. And it's called Emdogain. Emdogain is an excellent product, and it's actually called enamel matrix protein. And what happens is that this is a mediator that was discovered as tooth development was studied. Because when teeth develop from tooth buds, they erupt in the mouth. This enamel matrix protein is there in the process of development of the root, of the ligament, of the tooth as it erupts into the mouth and the gum tissue. And as you see on the top sentence, these enamel matrix proteins are only produced during tooth development, because that's their role, is to create the attachment for your teeth so you have healthy teeth and gums. But with modern science, we were able to isolate them, and we're able to artificially now have it in a vial and a little syringe that we utilize, and we use this enamel matrix protein, which allows us to regrow the layer of the root surface, which is very important, because when you get recession, the root surface is exposed. But by treating it with this mediator, this Emdogain mediator, this allows that layer to regrow. It's called cementum. That's the scientific name, cementum. And it allows it to regrow. And when it regrows, it allows the ligament to reinsert into the tooth, and you get very nice healing of the mouth. Next slide, Buddha. So the enamel matrix protein mediator has a lot of positive impact. It's been studied many, many, many years. Here you see about 103 papers. And it does a number of different things. Number one is it allows the graft to heal by blocking the surface cells from getting in. Because what happens is, in order to get the gum to really reattach, we don't want the surface cells to win the race. We want the below surface cells, which is called connective tissue, and the ligament fibers to have an attach and to reattach, to have that chance and advantage of reattaching before the surface cells. So this matrix derivative blocks those cells, those surface cells, and it increases the proliferation of the cells that we want, which are called periodontal ligament cells. That's what PDL stands for. And the gum cells that cause the attachment, which are called fibroblasts that you see there on the screen. And they also help something called osteoblasts, which means the bone cells that grow bone, and the chondrocytes, which are the cells that help to grow cartilage, because all of these things are important in getting your gum and your bone back for you. So this endogain matrix protein derivative influences the expression of certain factors in the mouth, and those factors lend to more growth and to mediators and signaling agents. What they do is they signal into the body and they signal into the bloodstream, and then what happens from the bloodstream and from the local tissues, they come into the area, and there they then transform into the specific function that we require to grow your gum, to regrow your bone tissues, and to give you this regeneration that is the topic of our segment today. Buddha, if we go to the next slide, please. Now, here you see on the left someone who came in, again, as you saw at the beginning, very unsightly recession, not happy, very sensitive, and if nothing is done, this is going to increase. The sensitivity will continue, it'll worsen, the recession will increase. The more the root becomes exposed, the more difficult it is to treat. So it's important to come in at an early stage because the root surface has no blood supply. Since there's no blood supply in the root surface, the more root that becomes exposed, the more difficult it is for that graft tissue to actually form and stay viable, or stay alive basically, over the root surface. So it's important that you see your dentist frequently and you take his consultation. And if he refers you, don't waste time. Or if you're concerned, because you already have this recession, that you come visit us directly. Now, here you see on the left the way this person presented. And here you see 3 months later, after the gum grafting, utilizing the enamel matrix mediator, and you can see the tremendous result that this patient obtained. Very, very happy. Next slide, engineer. Okay. So here on the left, you see something that probably you're looking at yourself right now and say, oh, well, I look like that. And again, recession. And the recession, when it occurs, it exposes the root surface. When you expose the root surface, now what's happening is aside from the sensitivity, you can also get decay, or you can get like a scooping out of the root surface, because the root is softer than the enamel crown. The enamel is very hard, like porcelain, and it's very resistant to the brushing, to the abrasion of daily function. But when you get down to the root surface is softer and it can abrade. So we don't want the gum to really be reseeded because of the abrasion that occurs, because of the dental decay that occurs, and because of the attendant sensitivity that's going to bother you. You're not going to be comfortable. And if it's not taken care of, then it progresses more and more. So there on the left, you see the preoperative slide. And what we did on the right is with a gum graft and the endogain enamel matrix mediator, we open the gum slightly, and we actually, like a little envelope, we put inside the envelope of gum some gum tissue that we got from a donor site, and then we put the mediator next to the root surface, put in the gum tissue below the envelope of external gum tissue, suture it, and here you see about 8 months to a year later on the right, the tremendous result that we've achieved. He was very, very happy. Next slide. Here's another one. This one again, root exposure, as you can see on the left side of the screen. The root exposure, you see the receded gum lines. Here it's a little more generalized. Many times this is also associated with what's called overzealous toothbrushing. It means that you're being too aggressive. You're using a toothbrush that's too hard. It's too abrasive. The toothbrush that you should use should be a soft toothbrush. A hard toothbrush is actually not good for you. And if you have one, don't use it any further. Buy a soft toothbrush, and that'll be much more gentle. It'll do the same job. And you actually want it to be soft because it deforms. It goes into different areas, and it cleans away the germs, the debris that's forming around the gum lines. It's important to do that because you want to make sure that we don't allow that to accumulate, inflame the gum tissues, and lead to recession and gum disease. Because gum disease, bone loss, gum loss is related to the germs and bacteria that we call plaque in dentistry that grow in the oral cavity. So one of the things, again, don't be overzealous, don't brush too aggressively, don't use a hard toothbrush, and don't load your toothbrush up with toothpaste. Because another misconception is, well, I want to foam my mouth and have a lot of toothpaste. Well, toothpaste has abrasive, and if you use too much toothpaste, it's going to abrade the gums, abrade the teeth, and it won't be long before you have a mouthful of recessions, which we want to avoid. As far as the last thing with hygiene is flossing. Flossing is very important because by keeping your mouth healthy, you'll avoid the recession, you'll avoid the gum and bone loss, and you could use any type of waxed floss. If you like a mint flavor, it's totally fine. And you do that once a day, preferably at nighttime before you go to sleep. So there on the left, you see what had happened in this patient, and they were overzealous in their brushing. They hadn't really been following up with the dentist the way they should with maintenance. One of the other things I was going to mention is make sure you see your dentist at the very least twice a year. I really recommend every 3 months because in my 40-year experience, when the patient comes in a little more frequently, they really don't ever develop a problem. And I think it's well worth it not to have the expense, not to have to take your time, and not to go through the procedures and have the problem to begin with. So I would recommend at the very least 6 months. Your insurance company won't pay for more, but really I think it's important to try to do every 3 months. It's in your best interest. Let's go to the next slide. Now, as we were talking about this enamel matrix derivative, I wanted to show you a little schematic of how I use this. And here you see a situation where there's bone loss between the teeth. That white that you see there, that chalky white, is a bone graft. And below the bone graft, obviously, was an area of bone loss. It was like a cratering that occurs from the gum disease. So what we do is we slightly open the gum and we get access to where the infection is occurring. We clean out the infection, we clean out the bacteria, the germs, and the tartar or the mineral deposits that we call calculus. We clean those out. Once we clean those out, then what we do is we treat the root surface. We treat it with a demineralizing agent that cleans it very well. And then we treat it with the enamel matrix protein that you see there in that syringe. That's the way it looks. It's like an orangish yellow color or gold color. And with a syringe, you place the bone graft, and then you wet the bone graft, if you already had the bone graft wetted, with the enamel matrix protein, and you put it in place. and then you close the area and you let it heal. So let me show you some results of how this enhances the healing in the area, how it prevents the surface tissue from growing down, and the results that we get. Next slide, engineer. And here, I'll show you an example. On the left, where it says baseline, there you see the black, dark area circled by the yellow circle, or the oblong. That's bone loss. That's an implant to the left. That's a tooth on the right. And there you see the black bone loss. In the center, there you see 5 months after the bone graft that I showed you on the previous slide. This bone graft, again, was done with the enamel matrix derivative. Very important to do it with that. And there on the right, now you see about 8 months healing. And you can see how on the radiograph, the bone has regenerated. You see originally on the left, it was black and dark. And on the right, now you have a grayish white in between the tooth and the implant. And that's because we've regenerated the bone. So that all the expense that you went through in doing those caps that you have, the implant that you have, we help preserve. Next slide. Here you see something that occurs with periodontal disease, severe bone loss. Again, you can see the black area between the incisor teeth. The black area is because you lost bone. So years ago, there was really not too much we could do about this. We tried, but it was very difficult. And nowadays, with this mediator and with the bone grafting techniques that we have, we really are able to achieve amazing results. And there you see on the left, the preoperative. And on the right, you see the tremendous amount of regeneration that's occurred. Obviously, our patient was very happy. Next slide. Here's another miracle on its way. On the lower is the way the person presented. On the upper is 10 days later. Again, you can see the dramatic result we get just 10 days later. Next slide. Now, what I'd like to do, Buddha, is I think there's a video, and I'd like to play that video before we go on. So if we can put the video on for our viewers, and I'll wait for you to do that. And while you are putting the video on, you can see the dramatic results that we get with this matrix derivative and how the amount of regeneration that we get is really beyond what we would normally expect. It really, the patients, when they get the mirror and they look and they see the result, they're so impressed by the result that they just start smiling. Some start crying. Here's another example. Well, I see we're having problems with the video, so it's fine. We'll continue with this slide. And on this slide, you can see how he presented on the top with an anatomic muscle pull. He was very uncomfortable when he brushed, and he had actually abraded his root surfaces. You can see that the tooth on the left has about 4 millimeters of abrasion. The root is exposed. The one on the right has about 2 or 3 millimeters. And you can see that the gum tissue is melting away. You can see it's a progressive type of problem. If nothing is going to be done, it's going to get worse. And it's going to be very difficult for me to help him with what he has. Here on the bottom, you can see the result 2 months later. And what we did is, again, we did a gum regeneration with a gum graft, and there you see it. On the bottom slide, you can see how I've relieved that muscle pull, that anatomic problem he was having. You can see how we've covered the root surfaces. You can see how we've created a border of gum tissue. And, you know, he's a very happy camper. Let's go to the next slide. There we go. And again, this is this is a woman who had braces. And unfortunately, she had a lot of crowding originally. Her orthodontist did a beautiful job putting the teeth together. You can see they're aligned very well. But the problem was that she had a very thin bone process holding the teeth. It's called the alveolar process. And in my office, what we have is we have a three-dimensional CAT scan machine. And we utilize that in many orthodontic patients because it's important preoperatively or pre-orthodontically to see what kind of bone you have. Sometimes we do procedures where we grow the bone and gum before the orthodontist starts to help prevent that. Sometimes, unfortunately, it's not possible or it doesn't occur, and you can get a defect like you see here on that incisor. She was very distraught, and when she came to me, it was really very advanced, and I said to her that I don't really know if we're going to be able to repair this. We can try. I explained to her all the different technologies that we had available in the office and that we would do everything possible. And so we went ahead with the gum grafting procedure with the matrix derivative. And that picture that you see is 2 months after the gum grafting in that area. And I gave her the mirror to take a look at, and she was just totally thrilled, couldn't get over it. Her orthodontist, her dentist were ecstatic. They were so concerned that she was going to lose her tooth, that she was going to need a dental implant, and that it never occurred. So for those of you watching this now, the message is this: visit your dentist. If you've already got the recession, call us, come in. We can help you with it. Don't be overzealous. Don't use too much toothbrush, too much toothpaste. Don't do too much toothbrushing. Follow the directions. Do proper hygiene. And hopefully we can see you in time. And if we do, as you can see, you'll be the next miracle. We will help you with what you have. We'll get you a healthy, happy smile, confident smile. I hope this has helped to give you a new outlook for those of you who are out there and were thinking that it was hopeless, or you were going to lose the tooth, or there was nothing you can do. There is something you can do. It's been a pleasure speaking with you, and I hope you found this very informative and helpful to you. Until the next time, be well, and we'll see you on the next episode of A Time for Truth show.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet